So what we want to do is to avoid the illnesses that come with obesity. Even a woman who is more than 20 pounds overweight compared to her young adult age, say how she weighed when she was 18, 19, 20. As she gets older, maybe has babies, she's often going to be more than 20 pounds overweight. That means that her risk of breast cancer quadruples. You can do Susan G. Komen for the Cure runs all day long, and you're not going to get rid of that risk unless you decide to lose the 20 pounds or more than you had. You can do mammograms 3 times a day for the rest of your life, and it's not going to decrease that risk. The only thing that's going to decrease that risk is life factor modifications. You can't change your heredity. If you're predisposed by heredity to breast cancer, it's not going to change because you lose weight, but there are modifiable risk factors, things that you can change. You can't change your genes, but there are other things you can change. You don't smoke, you lose the weight, you remain active, you avoid things that are carcinogenic. So we can talk about that at some other time, but the point is, I want to drive home the point that obesity is a plague upon the land. It is a recent phenomenon. It is something that affects us personally because it affects our health. Even if we're young and overweight, we need to have a long game view of life, a panoramic view of life that shows us that the things that we're doing wrong in our youth are going to affect us as we get older. And then when we get older, we'll look back and we'll say, boy, I wish I had done it differently. But you know what? That precious commodity that you cannot get back called time will be gone. So let's take good care of ourselves while we can.